There you go. I'm Gary Harbison. I'm the Executive Director of the Missouri Coalition for Oral Health. I want to thank you all for joining us this afternoon. My apologies for the delay, but technology is always wonderful, but it does turn on you once in a while and you have to fidget with it. So we did some fidgeting. That's probably a double entendre given the topic of our discussion today, but I think it can work well for us. I was going to say the coalition has tried to promote teledentistry for quite a while now. I think the first discussion in the state, or at least in-depth discussion in the state, happened at one of our conferences several years ago when we brought Paul Glassman in. He is nationally recognized as being an expert on teledentistry. But Dr. Suter is getting up there as well. He's doing a lot of consulting around the state and around the country, and as he should. He knows his stuff. So our two speakers today, just real quick, Doris Beckman, who's one of the co-founders of Community Asset Builders, and I believe you're what is referred to as a partner and chief operating officer, if I have that correct. But you can correct me if you'd like. Hearing nothing, I'm going to say you're in agreement with me. And then Dr. Suter is the coalition board chair, and he also is a dentist in private practice and the owner of Greenleaf Dental Care and the owner of Access Teledentistry. So with that, I am going to turn it over to the two speakers. Try to keep your I'm hearing an echo now. So I was just going to say, try to keep your mic muted if you're not speaking. I probably will intermittently mute people if I see a little bit of noise on there. And so I'll let you guys go.
Thanks, Gary. I'm going to hand it over to Doris. She's got the first section. She's going to outline for us what we're calling the Oral Health Connect program. And it is funded by, well, if we get the grant here, it's going to be funded by the USDA. So people that are joining us, thank you. We sent out a brief survey to get feedback on who would be interested in this grant program that the coalition would write for. And we'll get into the details that I think are it's a nice project, well-rounded. It gives everybody some new resources. Go ahead, Doris.
Not hearing you, Doris. Not getting you, sorry. Well,
I can drive for Doris if she's not available.
It looks like we're not hearing her. I'm sorry, Doris. I don't know what to do. Your showing is not muted from my side.
Yeah, we can't hear you at all.
Yeah.
Sorry, Doris.
Better launch.
All right, I'll launch. I hope I could do her slides justice. Feel free to jump in anytime, Doris. But essentially, the purpose of this grant is to assist rural communities in acquiring two things, either distance learning opportunities or telemedicine technologies to provide services and help educate people in rural areas through telecommunications. And so the USDA is offering this grant funding. And so in order to get this main grant, we need to find providers that are somewhat rural, and we'll get into that definition, okay? Because you might be surprised that you are in a qualifying area. And so it covers two components, okay? Distance learning, a telecommunication link to an end user with eligible equipment to provide educational programming and instruction, whether you're rural or not, to the students and the teachers, whether or not some are in urban and some are in rural, okay? So that's the first piece. There you are.
Can you hear me now?
I do hear you.
I actually have logged. I logged out of Blue Jeans altogether, and I'm just calling in
Okay.
But I have the slides up on my own, so I'll just advance, and when you hear me change, just advance so they
Perfect.
can, will that work?
Sounds great.
Okay.
Absolutely. We're on the 2 components slide.
Okay. Let me get there. And again, one of the questions that I had asked was how many folks were on the call, because I missed that because I haven't been able to hear.
There's 17 at this point.
Okay, and my apologies. I actually got a new Surface Pro last week, and they installed everything, but obviously some things still are glitchy. So in terms of the USDA Rural Development grant, the distance learning, it's not new. It's something that comes out annually, and we have been writing them for a number of times, and it has 2 components. Some folks just apply for the telemedicine component, others apply for the distance learning, and then there are others that apply for both. And the coalition is actually applying for both under this particular project, and it consists of both distance learning and, rather than telemedicine, it's teledentistry. But what we are referring to, it qualifies as telemedicine. So on the distance learning piece, there has to be a number of end users that are benefiting from an educational program or some type of instruction. And that is what we are trying to put in place for basically a teledentistry echo for those of you, and Dr. Suter will probably cover more of this in detail when we get further along. But basically it's providing the educational component, and it has to be done via distance learning. And then the telemedicine or teledentistry component, again, you have to have end users and hubs and use what they consider eligible equipment, which would include audio, video, graphic, and other formats. So we'll be going into a lot more detail on that. Next slide. And then these aren't the only eligible purposes, but it's particularly the things that they're looking for, so that they will fund. So they'll fund computer hardware and software, they'll fund site licenses and maintenance contracts, extended warranties up to 3 years. And the reason they limit it to 3 years is it is a 3-year funding cycle. So even if you get the award, you can spend the bulk of the money in year 1, but it is a 3-year project, so you can budget over the 3-year period. They'll cover the cost of audio and video equipment, network components, the telecommunications terminal equipment, data terminal equipment, really and even some inside wiring. And so they cover quite a bit. What they don't cover are salaries and personnel. So that's not anything that can be included. This is really pretty much strictly a capital grant. It does cover some training on equipment. Next slide. I keep forgetting I got to do my next slide. Other eligible purposes are acquiring the instructional programming. So if there's a curriculum that you can just readily purchase, they'll allow you to spend the funds on that. And they'll also, again, provide the technical assistance and instruction for using the equipment or any of the related software. So if it's something that you're not familiar with, and the vendor, once they install it, can kind of give you and your staff training, that is covered. Next slide. The grant itself, over the 3-year period, the maximum request that can be made is $1 million. And of that, they require a 15% match. They prefer cash match, not in kind. And we'll be talking a little bit more about that as we get further into the discussion. But we do have, and I don't know, Gary, did you mention earlier any of the stakeholders from the state level and the match that will be covered there?
I have not mentioned that.
Okay. Well, we do have some, and I'll leave that for a little bit later, but we do have some of the match covered already through intent commitments from a couple of private foundations. And then the real intent of this particular funding is to benefit rural areas. So they're looking for populations of less than around 20,000 or less. And they don't want those communities necessarily adjacent to population of 50,000 or more. Now, they won't eliminate an application if there are some adjacent, but they won't fund an application if it's 20,000 or more and it's right next to a 50,000 population. They score based on how rural a community is, and I think some of the future slides will cover that a little bit better. One of the things that gets confusing, and I really feel like this language is very beneficial, this particular slide on hub sites, end user sites, and hub end user sites. They're very distinct roles, and they're defined by USDA distance learning. And so to them, a hub site is a facility that's part of the network, which is part of this project, or the telecommunication system that provides the education or the medical services to others. So it could be like a university or Show Me Echo who provides to an end user or a hub end user. So they are basically hub only. They really are exclusively the education or medical source of the distance learning or telemedicine. And then there's the end user site, which is what many of you would be, where as the end user, you are taking advantage of a hub end user site, someone who either provides you through the hub, the education, or provides you as a hub end user the consultation services that you might need. So as we get into this, we'll probably have some conversation about what you think you are if you don't know. A hub end user is a site that in some capacity serves as a hub, where they may have a dental provider who's actually providing services. The dentist is providing services to maybe the dental hygienist that's at a satellite site. That hub end user could also be an end user if they're participating in, for example, some educational programming for their dental provider. So they have both roles. Next slide. In terms of the grant itself, the scoring considerations really are both objective and subjective. A lot of the criteria is built on how rural the application is, and the way they score rurality, again, is on population, and it's broken down. So the more rural you are, the higher your points, and that's per site. So there's an opportunity to get a pretty good rurality score. Economic need is based on poverty, and they use 2010 census data. Even though it's old, they feel like it's very consistent across the board, so that's what they use. And then there are some special considerations, which I'll cover in the future. Then they also review the application, which has quite a bit of narrative content where you talk about need and the services and the benefits. So that's how they score the application. I mentioned that there were some special considerations. They do give extra points if the application is focused on STEM education or opioid or substance use disorder treatment as a primary purpose. That is not a primary purpose of this particular grant, but you also get 10 extra points if you have applications that are physically located in an opportunity zone. And that's one of the things I don't know yet. I can't imagine if we have a number of applicants that someone, if you're in a rural area, won't fall into the opportunity zones. And I know who those locations are. We just have to look them up by census tract. So stay tuned for that. Next slide. And I think this, Dr. Suter, was where your slides picked up. I don't know if we wanted to take any questions. I think maybe we wait for the questions at the very end and just let people kind of absorb as we go.
Sure. Yeah. So I'm going to get into kind of laying out our plan on how to apply for that criteria. Okay. So we're designing a program for dental organizations, private dental offices, dental schools, public health departments, FQHCs to work together. And so the two components we address in this grant is the distance learning part. And so we're going to have an echo that everyone on the program would be a part of, a once a month CE, okay? As well as we would bring in four webinars a year with national speakers, okay? So you'd get CE for that, okay? And you would also, we would be providing telemedicine through this grant, which is teledentistry. And so participating organizations will get funding from this grant to get equipment or broadband or infrastructure and assistance in implementing teledentistry, okay? Now, the bonus thing outside of this grant, because we have potential external funders, is we would have a bonus of providing training for expanded function dental assistants, okay? So that would be a bonus on top of what the USDA funding would allow for, as well as a double bonus where you would get, we don't know the exact amount, but participating organizations would get funds to pay for enhancing your PPE in response to COVID. So pay for supplies, equipment, or infrastructure around that, okay? And I'll get into this all a little bit. And so some of the leading topics right now in dentistry post-COVID are around these areas, okay? Infectious disease control and infectious disease management, teledentistry, non-invasive treatment and chronic disease management of caries, as well as surgical treatment and how to manage those patients and decrease risk, okay? So these things are what our grant, the learning part of our grant, would focus on, okay? And so whenever we say there's two pieces to the grant, essentially to the USDA grant, there's a learning piece and teledentistry equipment funding, essentially. These are the topics we would focus on in our once a month call that you would have to be a part of in joining this, okay? And you get CE for that. And so we're using the ECHO model. And so if you aren't part of the ECHO model, it's based out of MU. And so MU's been doing this for a number of years. We actually already have an ECHO that we are going to use for this purpose, okay? We have an oral health echo with specialists on board. And what an echo is, okay, it stands for Extension for Community Health Outcomes. And an echo is different than telemedicine. It's a way to decentralize knowledge, essentially. So you have a hub team of specialists. So I facilitate the echo currently. I am the facilitator, the host of the echo. That's ran from MU, and we have specialists from the different dental schools and organizations around the state, okay? And they're a panel that presents one topic every it's an hour over lunch. We present a topic for 15 to 20 minutes, and then people submit questions to the specialists. So you have direct access to ask questions of specialists, particularly around cases. So we prefer you to submit a case you've got questions about to the specialists a few days before, and then we talk about it as a group about different options for that. Okay, so that's what the ECHO model is for. These echoes that are going in all these different categories across Missouri, and they've been going for a number of years. So this is a map that shows that since 2014 when they started. We currently have an oral health echo. It's the second Wednesday of each month. We just had it yesterday, and it's over the lunch hour. We have a panel on our hub team, and I'm the facilitator. We have Craig Hollander, a pediatric dentist. We are bringing on an infectious disease internal medicine doctor, Dr. Dandachi from MU. We have prosthodontist, Dr. Kruger from the ATSU Dental School. We have Ramona Muller from the dental school. She is an oral dental hygienist. We have a new pharmacist on our panel, Dr. Stephanie Christ. So she's out of St. Louis. And then we've got Dr. Satish from UMKC. She's a periodontist. And Dr. Richard Vargo, our pathologist, who's on our panel. And so they're all on the panel to support in this learning collaborative piece of our project. Okay? This is what the hub, the echo kind of looks like. So I just kind of threw it on there. We use Zoom to do that. So what we would do if we get this grant funding is we're going to make the focus of the ECHO sessions and the topics we cover to focus on ways to help dentists in a post-COVID world, okay? So we're going to pivot our current ECHO to provide didactic course content around these things. Okay? And so here's just some examples of brainstorming that we've had. If we talk about infectious disease, we could be learning about how contact tracing works. I hear a lot about the buzzword of contact tracing. I don't know how that factors into the healthcare world, and definitely how it impacts dentistry. I don't know if that means I feel like I should know how that works in case someone shows up at my door. I don't know anything about it. So that could be a topic. Studies, the latest studies on aerosols and containment of aerosols, antibodies and vaccines, like some of the latest stuff. And so we're going to have a new member of our hub team who is an infectious disease doctor. We will talk about teledentistry as a topic too. So people can submit questions like, hey, I have this case. How do I do teledentistry for these kinds of situations? We're there to talk to you about that and go over some of the things that people are asking about teledentistry. And also non-invasive treatments. So if we're wanting to reduce aerosols, we could talk about silver diamine fluoride, Hall crowns, glass ionomers, and interim therapeutic restorations. And then when it gets to surgical treatment, we could talk about the latest studies on how we're managing in a COVID world, how we're managing our surgical treatment, and the proper ways and best practices that are emerging around that topic. Okay, so our echo that we currently have is going to be a core piece of this. Anybody here on the call or others that end up joining the group would have to participate in this echo, okay, once a month. And we're asking people to commit to it, the once a month. And in order to join the group, we're asking you and the hygienist who would be doing teledentistry to, it's not just for dentist hygienists. We actually get school nurses and other people on these things to learn about oral health. And so, when you're a part of this group, we're asking you to come to 9 of them out of 12 for the year, okay? So some of the topics I said we could talk about, we're going to bring in some webinars on top of this. So for a year of some national leading experts on these core topics that we were talking about. So we could bring in OSAP just to talk to our group of people on this topic, okay? And we can answer questions. As far as teledentistry, we could bring in speakers and learn about, the latest data. Like 1 in 4 dentists right now are doing some form of teledentistry. That was not going on before COVID happened. And we can even break down and talk individually about the different applications of teledentistry. You might be doing one way, but there's about a dozen ways, different ways that you can do teledentistry in some form or fashion. In particular, I've been trying to break this down for people to understand just the different types of visits that they can have. So you might be able to intake limited evaluations, new patients, adult recalls. You might even get patients submitting stuff to you. We can go deep dive into this stuff with this program, and you guys can have the support as members of the hub of the ECHO and the program, the Oral Health Connect program, to get the resources you need to implement some of these things. We could bring in speakers to talk about interim therapeutic restorations. I recently, I did 2 of these this week. I don't normally do them, but I'm trying to cut down on aerosol procedures right now because I'm only using one room that's closed for my aerosol procedures. And so if they're in the other chair and I need to get them taken care of, this is a way to actually stop decay, scientifically proven, lots of studies. This is a report from the American Academy of Pediatrics that I put on here. And also surgical treatment. Everyone's guessing how they're going to do this. So if we're here as a group learning together, having a community where we could talk openly about what people are doing and learning from each other, we could figure out some of the best ways to protect ourselves and our staff and our patients. And just threw a bunch of pictures on here to kind of outline some of the things that are being done. Everyone's doing the thing on the upper left pretty much. Some people are choosing to do the thing in the middle and the thing on the right. I don't even know how you could do dentistry with a big old box like that, but apparently some people are. Just to kind of outline the whole program, I kind of made a couple graphics just to kind of do this. So Missouri Coalition for Oral Health would be writing the grant for everyone. All right. And so and then we would have curriculum partners to provide the CE that we're talking about. And so Missouri Telehealth Network would host the ECHO. and then they would, and then we'd bring in the Missouri Dental Association or other organizations. We haven't nailed this part down, where they'd provide the webinars and the EFTA training, because we feel like EFTA training is going to be really important going forward in post-COVID world, because the doctor can't bounce around as freely as they were before between chairs. And so having EFTAs available is really going to allow us to get back to seeing as many people, as close to seeing as many people as possible as we were doing before COVID. And so we're bringing in external partners to match some of the funding and to allow us to do some other creative things. So Missouri Foundation for Health is looking to partner with us on this grant to provide some of this funding. And this is just a graphical representation of the echo here in the circle that supports private practices, FQHCs, dental schools, and public health programs around these COVID-related, dentistry-related topics, and that's what the core of our echo will focus on. When you get if you were part of the program, we get the funding. What you would be using the funding for is these are some things in the dental office that you could use the funding for: Wi-Fi upgrades, fiber, 5G LTE backups, and different ways that you could connect to the internet. Also, software. So if you want to get an asynchronous or synchronous teledentistry platform, or you want to digitize your form system so that you're able to intake a patient for teledentistry, those things count as teledentistry because they're a piece of it. But they're also just important in a COVID world for you to digitize your process and not have as much paper floating around and things handed back and forth between people. And so that's some of the funding opportunities. Then also equipment. So if you need to get to do teledentistry, if you need to get digital X-ray equipment, intraoral X-ray, extraoral X-ray, a scanner, a camera, telehealth carts, things like that. Those are applicable things that you could get with this funding. All right. And so here's the breakdown. I made an error here and I put 4 years. It's really a 3-year program. But what your organization will receive in this programming is free CE for participating in the ECHOs, okay? Free CE from the National Webinar Series. You can request a maximum of $50,000 in teledentistry equipment, software, infrastructure. And you may be eligible, we haven't come up with the exact dollar amount, $2,500 to $3,500, it looks like maybe, depends how many people participate, in PPE funding for you to upgrade your PPE, buy a washer dryer. Like I bought a washer dryer for my office, and it'd be great for me to maybe get some scrubs for everybody, or whatever it might be, or maybe it's some way to contain your aerosols or something to that effect. Whatever way, we want to supply that, because dental offices have been closed for 2 months, and it's a lot of money to implement all this change. The next thing is you could get 1 to 2 support staff, the cost paid for them to get EFTA funding, all right, funding for EFTA training. So that's what the organizations would get if they join the program. It's a 3-year program you're signing up for, and there are some requirements to join it, okay? And so you would be required to match your teledentistry USDA grant amount. So up to 10%, or at 10%. So say you're asking for $30,000 for equipment and stuff, you need to say that prove that you have $3,000 to put towards it as well in your invoices. All right? So a 10% match. If you're able to get $30,000 plus $3,500 PPE and online CE whenever you can't even go to conferences for the next 2 years, that's a really good deal. It's a super good deal. You're also required to join the ECHOs, 9 out of 12 of the ECHOs, and submit cases and questions to the ECHO. All right? So that's a requirement. And then there will be twice a year surveys on how things are going, because it's a federal program, so we got to report to them on outcomes, okay? So there will be like a digital submission of a form to fill out every 6 months, and we don't know the details on what the questions are going to be, but there are some examples of those questions that are on this form that we're going to get into that you're going to need to submit if you're wanting to say that you're interested in the program. And so we're calling that the community abstract and commitment form. And I'm going to hand it back over to Doris so she can explain that, okay? Because if you're interested in everything I talked about, you need to submit this form, and we have a short turnaround for you to submit the form, and maybe she could go into that.
Yes, yes. And I don't know, Dr. Suter, if you want to pull the abstract up for them to look at while I cover, some of the high points, because it might be good for them to see some of what we're looking at. But basically, the abstract is a letter of commitment, and you will sign it stating that you agree to participate in the application, and then it has some of the stipulations for what that means. It will ask you to provide the address information that we will use then to help determine the rurality and economic need and the special considerations for each site. It also will allow you to submit more than one address. So if you've got a practice that has multiple clinic sites and you want to do this in more than one location, we would need each of those sites because each one qualifies separately. And you could get the equipment that Dr. Suter spoke about, up to $50,000, is across the sites. It's not $50,000 per site. It's in total for all of your sites. So depending on what your resource needs, you might only be able to do one site. But for those of you that only need certain resources, you could possibly do multiple sites. It provides data that we need for the application development because it asks some very specific questions in that 2 pages. It shows that you are willing to provide that 10% cash match and asks what your actual request is. And there's even a sample budget template so that you can calculate based on what your needs are. And I don't know, do you have that up? Because I can't see what you said.
Yeah, that's right. You're on the phone. You don't even know. But I'm panning through it right now. So I've got the form up, guys, and there's information about the program on it, and then some definitions for you. And then the next section here is, again, the end user, hub end user thing. And if you aren't sure what you are, please ask us. I'll give you some examples. If you're a health center and you have another location, 2 locations where you have a clinic, and then you have a portable location. If the portable location is using teledentistry to communicate to the other 2 places, then you have your portable one is an end user site, and your 2 other locations that are also that they are hub end user sites. Okay, so those are places where, and you might be able to do you could do teledentistry between those 2 locations as well. So that's just how that works. I myself have a private practice, and that site I do teledentistry on different days. So like my hygienist was there yesterday, did teledentistry today on those patients. My location is an hub end user site only. I don't have an end user site. Now if I had my hygienist go to the nursing home, that would be an end user site, the nursing home, if that makes sense. And so here's the sample. These are just generic rough prices based off of grants I've written with people and gotten quotes on. So we need an estimate for each person, that's a group that's applying, on about what they're thinking they're going to request. And so if you could fill this part out, it would be great. About how many of each thing that you might be interested in, and if there's some other thing that you think may apply, just write it in the blank line or attach something to it if you could. Okay. And then this is the more detailed information that you need to include. So this is about your organization and some questions about your organization and where you're at in the phase of implementation. So like some people are wanting to join this, but they might already been doing a little bit of teledentistry, or they've already gotten a grant, but they haven't started teledentistry, so they might not need equipment. So this just kind of gauges where you're at in the process. And then there's a little bit about the reporting and whether or not you can report on some of the things that we need to know to submit our reports to the USDA on impact.
And I would just interject here that the reason we're asking this is we want to see what most of you are able to collect so that when we write the grant, we put in things that we know we will be capable of collecting. We don't want to make this challenging if you get the funding, but they will obviously want some information, patient satisfaction, and probably who's being served and what services are being provided.
Yeah. And then you would print this and sign this, and then the thing that makes these applications really stand and have legs to them is commitment, like letters like this. They show, oh, they've got 10 of these people that have signed up. It's not that they're going to get the funding and then try to find people. It's people that are definitely interested in this. So that really helps. Mm-hmm. And then this helps us budget it and then figure out how many sites are rural enough to qualify. And then what do you think about onboarding these? If someone's on the call, Doris, but they don't think they can join this year, they might be able to join next year. Can they still sign it? Because it's a 3-year grant?
Yes.
Okay.
Yes.
Great.
Absolutely. And I think state that. It doesn't say on here, but if you feel like you want to participate in the learning collaborative before you jump in and make your request, indicate whether you're interested immediately or in I would say year 1 or year 2, we would want you brought on. And in year 3 is just the data collection. So if you wanted to be year 2 or held to year 2, that would help us with the budget as well. And I would add one thing to the abstract. Right before they do the summary of the understanding of commitment, the very last box ask you to estimate the number of individuals that you think you would serve. And I know for some of you this might be difficult to determine, and that might be a conversation with Dr. Suter or the Coalition or the Office of Dental Health on, when you first start up, what percent is generally served via teledentistry. But we really kind of need to know that too, because they want to know with the $1 million budget how many people are going to be impacted.
And so, if you could do the some things that I do when I'm writing grants and I'm making my but these are estimates, so don't get too caught up in I don't know. I've met people that are scared to do this because it's federal funds and they don't want to write something that's wrong. You do your homework and make your best guess that you can. So for example, if you're going to do teledentistry at your satellite office 2 days a week, or in your portable program 2 days a week, how many people can you see in a day? Usually it's like, how many people does your hygienist see in a day? 8 to 10. Okay. 8 to 10 people, 2 days a week for 40 weeks. That is your number. Okay. So something like that. That would help you. Okay.
Mm-hmm. And the good thing is you won't be held to that number by site. We'll have an overall number that we provide to them collectively across all the sites. And some folks will probably see more, some might see less. There might be something that happens. Everything is always qualifiable. So I don't get too hung up on the estimates. We just have to give them a number. And then I really don't have anything to add. I think this is a good time to open it for questions. The grant is due July 13th, and that's why the turnaround on the abstract, which will go out probably right after this call, will be due next Friday. Most of as you saw, it was yes, no, or just a few fill-in-the-blank things other than your budget. And the reason for that quick turnaround is the data piece on identifying the rurality and the poverty is going to take quite some time. And we also have to do some geographic needs assessment on the regions that are going to be participating. And so there's just a lot of data work, unfortunately, that has to go in on the back side. And we can't do it until we know the sites. So that's the reason for the quick turnaround. I don't think I have anything other than that to add, other than we have a lot of the narrative already kind of framed out based on a lot of what you saw today, but there are just some holes until we get the abstracts back. And I'm going to throw it to you, Dr. Suter, to facilitate any question answers.
Yeah, anybody got
Or
any
to
questions?
Gary. Or concerns.
Paul asked if both organizations and solo practices. Absolutely. We want solo practitioners to get involved, and the USDA does not care if you're for profit or not for profit. So really, it comes down to, are you doing telemedicine, and are you willing to do telemedicine, teledentistry, and are you in a place that is 20,000 people or less in your city? So like my office is in House Springs, Missouri. I think it's 15,000 people, and so I could qualify. It's not really that rural. So a lot of people, they feel like it's rural, but it's not really that rural.
Yeah, I was going to emphasize that because USDA really looks at this in a way different from anything I've ever seen before. A little confusing, but areas that you might think are fairly urban actually would work out.
Mm-hmm. And they don't rule out a necessarily large rural area. For example, if you are over 20,000, you can still participate if you're interested. It just adjusts the overall score of the application, the rurality score. So, the coalition wanting to receive the highest score possible is probably going to limit the number of applicants, of 20,000 population or more. Because if you don't have at least a score of 20, you're not eligible. So there are some things that come into play. So that's why we're really looking for communities at 20 or below. But if you've got a larger population than that and you're interested, I would complete the abstract and we'll keep you posted on, how we can proceed with that. Wouldn't you say, Dr. Suter, Gary?
Yeah.
Yeah, exactly.
And there's even other possibilities, like we're finding a lot of people funders and partners interested in this. And if if we bring in, 5 more people outside of the USDA funding with other money, like that is possible.
Yep.
Any other questions?
Can you hear me?
Yeah.
If you bring in other funders, are they able to set their requirements or metrics, or are they just contributing to the outreach that you're trying to do through this grant?
Go ahead. Go ahead,
Doris.
Doris.
To that, because the application is going under USDA, those other funders would meet these obligations. So they are actually a stakeholder in what we're proposing, and so they wouldn't have additional requirements added on top. They might have the coalition report on some things that the coalition is doing as a partner, but there wouldn't be any additional data expectations from the participating providers. Generally, that's the way it works.
Yeah.
Well, Gary knows that we don't have a lot of money, but the foundation grant program's open, and that's the kind of target we would hit. You could maybe get $3,000 to $5,000 from that if you turn that in before, obviously, your deadline, which is before our deadline.
Okay, thank you.
Yeah, that's great. Great. Well, I guess we answered everybody's questions, Doris.
I'd be curious to know from folks on the line, either through chat if you don't want to talk, if you think you're going to pursue, because we really are hopeful that there will be quite a few responses to the abstract. So I'd be curious to hear from folks if it's yes, no, or a strong maybe.
Lisa Bosch says yes. Good to hear it.
Okay.
and nobody else wants to talk.
I guess I will go ahead and ask. Both of the locations that I'm looking at are extremely rural. Both counties are the whole county's under 20. But what I'm wanting to do is like while I do teledentistry in one office, I'll be working in the other, and then sort of like back and forth. So is that like hub end user?
There would be two hub end user sites.
Hub
my
end user,
guess.
yes.
Yeah.
Yep. Because you would need both types of communication at both facilities. And that's really good. And just on the rurality, if the entire county's 20 population, they actually do the rurality calculation on the place within the county, so it's the town itself. And if it's 5,000 or less, you get the maximum points of 40 points for that location.
About to get 80 points.
Woo!
Important.
Woo! So don't go based on county. If if you think you're rural, you should fill out the abstract. Let us determine the rurality of the location, because it's very different than any other type of federal funding. So don't worry about that. I say if you're Kansas City, St. Louis, Cape Girardeau, even Cape Girardeau, though, I mean, if it was a small town within Cape, that you were providing services from, things like that, just submit your address. We'll be able to determine.
Great.
So this is Steve Billings. I have a question.
Sure,
So
Steve.
I have 3 offices, and I think one of them would qualify. I mean, I guess my feeling is that yes, I'm interested, but if I go through filling this out and everything, and then find out after the fact that I don't qualify, I feel like I kind of wasted my time. I don't mean that in a bad way, but I have one of those. I'm around the Kansas City area.
Okay. What are the towns? And we could look that up and get back to you.
Okay. The first, it's Platte City, Missouri, Parkville,
Grant
Missouri,
City?
Platte City, Platt City,
Okay.
Parkville, Missouri, and Belton, Missouri.
So Grant City, Platte City,
Yep.
Parkville, like
No.
PARK.
No. Yeah. Okay.
And
Platte
Belton.
City is PLATTE.
ATTE.
Uh-huh. City.
And
And then
Parkville.
Parkville, PARKVILLE. And then Belton, BELTON.
Okay, I'll look these up and I'll send it to Gary, and he can let you know. That way, if you complete the abstract, you only complete for the ones that would be eligible.
Okay. And one more question. I teach at the school also. I mean, would like UMKC be drawn into this some way, or maybe that's a question for Nathan. I don't know.
I think I would defer.
So we have one faculty on the Echo, and so I don't know if anybody at the UMKC is on the call, but they could go for it. They would make the overall score go down because they're so urban, but like your one town's 23,000 people and the other one's 5,000 people, so just a quick Google search, and so you're doing pretty good, I think. Dr. Billings.
Yeah.
At least in those two.
Okay, great.
And it would be if you have a mobile program, your mobile program would be based off of your address, right? That would be my understanding, Doris. Not on the sites you go to.
It's your primary administrative site address. So, like for a health center, they might not even provide oral health services out of their primary site, but that's where their mobile clinic is attached to, and depending on where that site is located, that would determine the rurality.
Okay.
Great. Any other questions?
All right.
And I'm happy to answer any questions, grant related or otherwise. If you forward questions, I would say forward everything to Gary, and he can determine if, he could send it to both Dr. Suter and I, and we can decide between us who could better answer. But anything that's related to the actual services is probably going to be Dr. Suter, and if it's grant specific, I can help with that. Or if you have questions about the abstract when you get it.
So we will, you will, on the email reminder for this and the announcement for this, you'll find my email address. And we will tag onto that email chain, and we will send the form out to you and a link to the recording of this webinar. And that actually will go to everybody on that email. That expressed interest, including folks that haven't attended today. But yes, absolutely. If you have questions, I'd be glad to answer them. So shoot them forward. Well, I'm going to ask again if there are any other questions that anyone has. There are no silly questions, so feel free to ask.
I apologize, I was a little tardy, but typically how long does it take for the grant to be granted?
That's a very good question.
That's a good question, and it varies, but I think that the turnaround on this is going to be pretty quickly because it's in response to COVID-19. It's usually between 6 to 9 months from the time the deadline goes in, because they take sometimes they take 3 months or so to bring in their objective grant reviewers to review and score the applications, and then it goes through the federal process to make the awards. But they don't provide you with the announcement date. Some federal grants will, but they keep that open. But I do know that they are wanting to get these resources out, so I think it'll be a much more quickly. I would say 6 months. And I know that doesn't sound very quick, but in federal grant time frames, that's pretty quick.
We are for the feds. So the other thing that we're considering doing is, like, if we get other funders and things kind of lined up first, we could start the echo process and maybe even that PPE part, and kind of get in the groove of things, because we already have the echo in place. So we might start to implement some of those pieces as we're going, so we get hit the ground running, as far as the education goes, and as far as maybe some of the other training and resources.
Mm-hmm. And I will reach out to USDA just to see if they have a target start date in mind.
Great. All right. Thanks, everybody. If you could fill out those forms and get them back to us within a week, we would really appreciate that, when we can kind of get an idea of how many people are on the call. And if you have a friend you know of that might be interested, please, send them, introduce them to Gary, and maybe we could get the webinar to them, and they could watch the webinar and fill the form out. That would be great. Thank you.
All right, everybody, we're gonna call it quits. Thank you all so much for attending this afternoon, and we should get that form and the recording link out to you hopefully later this afternoon. If not, we'll probably shoot it out over the weekend. Thank you so much. I'm going to stop recording.
Thanks, everybody.
And end the call.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Have a great weekend.
Thanks. Bye.